Welcome to this quick and clear explanation of arterial blood gas analysis, or simply ABG. Whether you're a medical student or a healthcare professional, this video will help you understand how to interpret ABG step by step. What is ABG? ABG is a blood test that measures the levels of oxygen, carbon dioxide, and the pH in arterial blood. It provides vital information about a patient's respiratory and metabolic status. Why is ABG done? ABG is commonly used to evaluate oxygenation, ventilation, and acid base balance in critically ill patients. It's crucial in conditions like COPD, asthma, diabetic ketoacidosis, and shock. Components of ABG pH shows the acidity or alkalinity of blood. PaCO2 indicates the respiratory component, while HCO3 reflects the metabolic side. PaO2 measures the oxygen content and SaO2 tells us how much oxygen is bound to hemoglobin. Steps to interpret ABG. Step 1. Check the pH, is it acidic or alkaline? Step 2. Look at the PaCO2. If it's abnormal, think respiratory. Step 3. Check HCO3. If that's altered, consider a metabolic cause. Step 4. Assess whether the body is compensating. Sample disorders. Let's look at a few examples. Respiratory acidosis, seen in COPD or drug overdose. Respiratory alkalosis, common in hyperventilation or anxiety. Metabolic acidosis, like in DKA or renal failure. Metabolic alkalosis, often caused by vomiting or diuretics. Sample collection tips. ABG samples are usually drawn from the radial artery using a heparinized syringe. Always perform Allen's test before the puncture. If there's a delay in analysis, transport the sample on ice. Summary. To summarize, ABG helps evaluate a patient's acid-base status, oxygenation, and ventilation. By learning to interpret ABG results step by step, you can make quick and accurate clinical decisions. Thanks for watching. If this video helped you, don't forget to like, share, and subscribe to the channel.